vaccine that obviously everyone has heard about and has been widely distributed. Many millions of adults have received it, not nearly as many children, although tests by Pfizer in clinical trials and also by Moderna for a very similar vaccine have been given and have been done, and we have found that the side effects have been significantly less in children than adults. I think that's partly because the dosage is a little bit smaller, but they seem to have less likelihood of fever and less aches and pains, and seem to tolerate it better. And I also think it's a function of the immune system in children being so robust, so they really respond very well. I don't feel that everyone appreciates how significant COVID has been and the kind of inflammatory reaction that the virus itself causes. So, well, I would like to say, boy, we should get it because by protecting our children, we therefore protect parents from getting it and grandparents and other people, and well, that's important. I think the real benefit is for the child itself. That virus is causing a tremendous inflammatory reaction, causing myocarditis and inflammation, and we're finding a lot of long-term side effects in adults who have received COVID, such as heart attacks and strokes and diabetes, and we don't really have a full appreciation yet for what kind of long-term side effects there are likely to be in children following getting the COVID virus inside of them. So protecting them with the vaccine will hopefully help reduce the chance of significant problems down the road for children. The risks seem to be rather minimal, and it really comes down to the side effects that we've seen in the virus. We've seen some fever in children, and we've seen some achiness. Usually it lasts 12 to 24 hours. I can tell you that as a study coordinator for the Moderna vaccine for children, the number of children who appear to be having significant side effects of any kind have been really minimal, and I expect the same to be with the Pfizer vaccine too. They've been very interested. They've been curious and cautiously optimistic. Some of them are a little hesitant because it's something new, and I certainly understand that. On the flip side, though, the volume of people who are interested has been tremendous. Our office has literally started giving the vaccine yesterday, and we will have given a few hundred doses by the end of today. So our phone has been ringing off the hook from people all over the community who would like to get the vaccine. But I've also had a lot of thoughtful questions from people who are very interested in making sure that it's a safe thing to do. There's been talk by some of, oh boy, my child or someone I know has COVID. Does that mean that they don't need it because the antibody response is high and it will protect them? We really don't know that. In fact, if anything, testing antibodies doesn't seem to correlate with whether or not one can get the disease again, and it's very likely that one will get COVID again, even if they got it once without getting protection from a vaccine. Also, there was one study that people like to cite of longer-term immunity following getting infection, and yet that was not a peer-reviewed study, and other studies are showing that that really may not be the case. So yes, people are interested, people are asking, they're asking sensible questions, and our phone is ringing off the hook with interest.